Welcome back, Richard. It's good to see you once again.
Yeah, it's good to be here, I think. Yes, it's good to be here.
You think so?
A fun topic today. Well, I shouldn't say a fun topic. A
Interesting topic.
It's going to be a very interesting discussion, and we're going to touch on a lot of points that we'll probably have to come back to in future podcasts because there are a number of important issues here, and we may not be able to do justice to all of them in just 30 minutes. So we'll probably come back to these.
It's a really important and interesting topic because it is something that we are confronted with very often now. And we've talked in some recent podcasts, we've talked about diagnosing, and we talked about the 80%, and we've talked about, this idea especially with adolescents where they come in and they feel as though they meet criteria, or that they have particular diagnoses, but a lot of that comes from Dr. Google and things like that. But today we're going to talk about making diagnoses in adults, diagnoses that are typically made in younger childhood,
Right.
In primary school aged kids, maybe by the time they're 8 or so, diagnoses of like ADHD, autism spectrum disorder, but making those diagnoses in adults who have never been diagnosed with these things before.
Right.
And it creates, we're going to talk a little bit about some of the challenges with that and some of the benefits of that.
Yeah, we've been trying to figure this out now because we're getting increasing requests by adults to do evaluations for ADHD and autism. Those are the two most that come up the most. They're not the only ones, but they're certainly the most frequent requests are adults who think they might have autism or ADHD. That would explain why they've had some of the life challenges that they've had. But this is a slippery slope, this idea of making these diagnoses in adults, because autism and ADHD are neurodevelopmental disorders. That means that they develop either before they develop in utero, and essentially you're born with them. I mean, you don't get ADHD when you're 6 or 7. You don't get autism when you're 10. These are neurodevelopmental, and that means they develop in utero, and you're born with them. You arrive with them. In most cases, these diagnoses are made during childhood. In fact, according to DSM-5, if you want to make a diagnosis of ADHD, you have to show symptoms before age 12.
Right.
It used to be age 7 or 8, I think, in the last edition. But in this edition, you have to observe the characteristics and before age 12.
Yeah. But I think that the other piece to this, I think, is that, so they're typically diagnosed early in childhood. They're typically, and as you said, with ADHD, you have to have the symptoms prior to the age of 12. But it's, when we try to go back and we try to look at things, we have this tendency, I think people sometimes have this tendency of sort of superimposing their current perspectives on their previous experiences. And so,
Right.
Yeah, I had a hard time in elementary school, paying attention and focusing. Oh, okay. But as soon as you start asking questions, it's hard for them to generate or remember some of those experiences.
Mhm.
And, we've talked many times before that, if a kid is having a hard time in class, is it because they have ADHD? Is it because they have a learning disability? Is it because the curriculum is too high and too difficult for them, like developmentally inappropriate, where they're doing algebra in 4th grade or something? So there's a lot of other things that go into it when you're making the diagnosis at the time of the kid being, 8 or 9 or 10 years old. When you're trying to do that when a person is 30, 35 years old,
Right.
or older sometimes,
Mhm.
it's much more difficult to figure those things out.
That's right. And yet that's our obligation
Right.
as clinicians, is you have to establish that the diagnosis existed before a person reached adulthood. Now there's about 11 to 12% of kids, and this varies from study to study and time to time. Children between the ages of 3 and 17, about 11 to 12% end up with a diagnosis of ADHD. The average age at which the diagnosis is made is 7.
Right.
So it's relatively early to make that diagnosis. And so that's the general pattern that we see. And we know that about 60% of children diagnosed with ADHD become adults with ADHD. It doesn't go away. You learn how to manage it, you learn how to deal with it, but the condition itself doesn't go away. What we're concerned about are people who are getting a seeking a diagnosis after age 18. And this is what we're struggling with, is can you really make the diagnosis? And is it really ADHD? And so you have to be very careful, because this diagnosis should have been made in childhood.
Right.
So what do we do with adults who are seeking a diagnosis of autism or ADHD? And about 5% of adults will end up with a diagnosis, even an adult diagnosis of ADHD. So a little less than half of the cases, or about half the prevalence of children. So children are about 11 to 12%, adults are about 5%.
Yeah.
This increase began, and I shudder to think about this, in about 2007. And you know why I'm starting to chuckle? Because what else appeared in 2007?
Right.
The
Yeah.
cell phone. Okay, that's when the first iPhones came out, was
Yeah.
2007. I don't know whether there's a correlation or not, but this is when it started to increase. But
Mhm.
the biggest increase was between the 10-year period between 2009 and 2019. It was a 123% increase in adult ADHD diagnoses.
Mhm.
But that number is increasing, and it's the same with autism spectrum disorder. They've doubled in that same 10-year period. The number of adults with autism has doubled. So we see this very rapid increase. Now, in addition to 2007, the other important factor here is that the biggest increase
Mhm.
in adult ADHD occurs between the ages of 35 and 44.
Yeah.
Now, that again is not surprising, because that's probably the busiest 10 years of adulthood, because you're in your career, you're having children, might be taking care of elderly parents, you're trying to build for savings for college or retirement or whatever. So that from 35 to 45 is a very, very busy time of adulthood. So it's not surprising that in this very difficult time of career and marriage and children, that the rates of adult ADHD would increase.
And I think for that exact reason, there's a lot of caution that we have to have. We started this piece of the podcast out talking about it's a slippery slope. And part of that is because, yes, this is a very busy time, lots of demands, lots of expectations on us. But because there's an increase in expectations and demands on us, does that mean that we now have ADHD because we're having a hard time focusing and concentrating? Or does that just mean that we're really busy and we need maybe some new strategies for dealing with some of these things?
Right.
ADHD is not a strategy deficiency. It's a neurobiological disorder.
Right.
And so you have to tease those things apart.
Yeah, I was talking to an adult the other day, and I said, okay, when you were 21, what obligations did you have? Well, I was in college, and so you had to do your college work. What other obligations did you have? Well, I didn't have any. Okay, now you're 40. What are your obligations? And she started to make this list. She has 3
Right.
kids, and she has a job, and she has a marriage, and she has a house. They have a house payment and cars. I said, okay, you're cluttered now. Your brain is cluttered. You just have a lot more to think about. It's not that you have a disorder. It's that you have your life is much busier now than when you were 20.
I know I always laugh when I'm talking to a 30-something-year-old and they say, well, yeah, and I think I had these problems when I was younger, but back then they didn't make diagnoses of ADHD. I'm like, 20 years ago, 30 years, they
We're
were
making
they were making these diagnoses. And
right,
and, and so if you didn't have it, if nobody was concerned that you had it
right.
then,
Mhm.
let's think about what else is happening, what else is going on.
Right. Yeah. So anyway, what this article says, so we acknowledge on the one hand that this is a slippery slope. When you're making these childhood diagnoses in adults, you have to be very, very careful. But then this article says, but on the other hand,
Yeah.
and the other hand is this. This article talks about three or four different people. One of them is a woman from Australia. And for 20 years, she said she tried to figure out why she was having panic attacks and why she was disorganized and why she was afraid. She had test anxiety and performance anxiety.
Mhm.
And her symptoms were so severe that she ended up dropping out of college. And as she got older, her life became more and more difficult. Well, part of her problem is that she was misdiagnosed. When she presented these symptoms to professionals, they diagnosed her with anxiety and PTSD. And that really, those were not accurate diagnoses,
Mhm.
because she also had poor social skills. She would learn scripts and she would learn how to smile. She'd have these almost method acting way of living her life because she knew she had poor social skills. She had very intense interests. She'd get very deeply involved in a specific subject, and she had some repetitive behaviors. Well, these are all signs of autism. Okay, why didn't anybody in the 20-year period of all the professionals she saw, why didn't anybody put two and two together? Why didn't anybody figure out that, well, she has these symptoms too? So, and you and I have talked many times about sloppy diagnostic workups, okay? Messy, too quick to say, okay, you have these symptoms, so you have this disorder. So she was done a disservice because nobody put all the pieces together. When they finally did, and she had autism, there was this great relief. She went back to school. She did well. She did much better, and she's straight. So
Because she
having
understood and she could apply the appropriate,
right now,
appropriate
she knew what
strategy.
she was dealing with. Right. Okay. The other story they present, and this about this general. This is a fascinating story. He was a two-star general,
Mhm.
United States Army, and they sent him to MIT. Must probably a smart guy. They sent him to MIT to get a master's, and while he was there, he got two masters and a PhD from MIT. And he said, "My mind was," he said, "My mind was like a supercomputer. I just absorbed stuff quickly. I could get stuff done quickly." But when he finished and he came out, he reached his tipping point when he was given command of 10,000 troops in the Iraq War. And he suddenly crashed and went into this deep depression. And his commanding officer, who happened to be the head of the Joint Chiefs of Staff, said, "Here's your choice, buddy. You either retire now or you go get the help that you need." Well,
Mhm.
when he went to get the help that he needed, he was diagnosed with bipolar type 2. So the supercomputer brain and the PhD and the two masters, that's because he was in a manic phase that lasted for a long time, lasted probably a couple of years. But then he just exhausted himself. So having an accurate diagnosis, now he understands why he was able to accomplish so much, got on the right medication. Now he's teaching at the War College and doing much better because now he's evened out the highs and the lows. Okay? So having a diagnosis in both of these cases, the woman in Australia and the Army general, having the diagnosis made it possible for them to reorganize their lives and do what was necessary to manage life as it really was.
Absolutely. And it's an indication of how important it is to get the correct diagnosis. And
Right.
and people, we fully recognize that clinicians especially will you're at there's a risk for erring on either way. The woman in Australia, you know, I can definitely absolutely appreciate the reality that, let's look at this as maybe a social phobia, some of the social difficulties. Okay, maybe that's social anxiety related to some of those issues, and maybe it's this, but you have to be willing as a clinician to evolve and to watch. I had a patient the other day ask me, how we look at some of those things and how we make diagnoses and how we can tell, if a patient is, if a patient is really the problem or if it's really an issue in the relationship and those kinds of
Right.
things. And I was telling her that, what we really try to do is look for patterns over time.
Right.
I think one of the most important things that we have as clinicians is we have to have a good memory. We have to either a good memory or really good notes,
Right.
because we have to be able to put these pieces together over time. And, yeah, certainly over a 20-year period, you would think, my goodness, somebody's got to
Right.
figure this out.
Right.
Luckily, somebody eventually did. Um, but I think that, when you're seeing someone, and one of the things that we see here is we'll see people who've never been seen before. The woman in Australia, for example, she had been treated for 20 years before they found the right diagnosis. A lot of times we'll see people and it's for the first time. And
Right.
we explain to patients that it's really one of the really difficult things is that, if you've dealt with symptoms of ADHD or if you've dealt with symptoms of autism spectrum disorder for,
Mhm.
for 35 or 40 years, since childhood,
Right.
and you have a job, you have a relationship, people come in and they're married and they have kids and they have jobs and they're doing all these things, but they're concerned that they may have autism spectrum disorder or ADHD. Clearly what's happened is over the years they have developed some compensatory skills. Clearly they have done something to be able to cope with their social deficits sufficiently enough to get married or to to have a job where they're working with other people. And so you've developed compensatory strategies, and my goodness, that is so difficult to tease through. Okay, how much of this is a compensatory strategy that you've learned because out of necessity that you've had to, and how much of it is well, these are just your skills, and maybe you just
Mhm.
strengthen some skills and you don't really have a disorder. It's really hard to tease those things apart.
That's right. So the first thing to remember in adults, there's three big issues. One is we have compensatory strategies. Maybe you have high intelligence or you took easy courses. You had lots of parental support. When you're in school, elementary, middle school, high school, you can get accommodations. Okay. You can't get accommodations on your job. People have tried.
Right.
I had a young woman one time who wanted accommodations on her job. She wanted to start at 3 hours later. Well, I had accommodations when I was in school. I thought, well, now you're in the real world and you don't get accommodations in your job. You either do the job or not. So, but you use these compensatory strategies to manage your K-12 education. But as an adult, the challenges are bigger and you have fewer accommodations.
Right.
Now the scaffolding that you had as a child, your parents were kind of making sure you did your assignments and they got you to school on time and your uniform and all that stuff. Those disappear when you get to college and particularly in the job. And so our advice to parents is let's remove the scaffolding as soon as possible. Don't wait until they're adults to remove the scaffolding. So that's one thing. We develop compensatory strategies and we succeed until, like the general, you get to a point where you can't overcome it.
Right.
So when he met his tipping point, when he was suddenly in command of 10,000 troops and battle strategies, and it just overwhelmed. Now he gets overwhelmed. He just wasn't able to manage.
Absolutely.
So we have to remember that if you've been functioning with the possibility of a diagnosis, but you're functioning and you're doing okay and you're working and you have a marriage and a family, you've probably learned how to compensate. However, and this is on the other hand, a diagnosis is helpful in that it explains why you've struggled all of your life. You have this, we knew something was off. We knew we were a little bit off, that we didn't see the world quite like everybody else did. But so now with this diagnosis, you have an explanation of why you struggled with friendships and jobs and why you had trouble reading or writing or math. Now you have an explanation. So having a diagnosis, having an accurate diagnosis, it also serves this explanatory function, right?
It does. And I think that, we're here we are, we're really just keep presenting both edges of the same sword, because the problem on the explanatory side is, of course, that this is what Dr. Google does, right? We look into it and we say, oh, well, I have this problem, or I find this difficult. We start out with why is it hard for me to talk to people the first time I meet them? And all of a sudden you go down this path of, okay, so you have autism spectrum disorder. Like there are thousands of things in between difficulty when you first meet someone and autism spectrum disorder.
Right.
But we get there because we feel as though that explains why we're having this difficulty. And we also, it's confabulation. It's like well, you know what, that is true, because I do have some of those behaviors. I will do that sometimes. So yeah, maybe that is what's going on. We have a tendency to, it's almost like a horoscope type of thing where you read these generalizations.
Right.
But
That's good analogy.
yeah, they're almost like generalizations that are at the same time a little bit specific enough for us to say, you know what, I did meet someone who I was surprised to meet, or someone from my past. I did meet them this week.
Right.
Okay, but we could apply that to all kinds of things. And so I think we have to be careful with that explanatory stuff, because yes, it's fantastic when it works out, and it does explain why you've had some of these difficulties, but we also have to be careful that we're not sort of reverse engineering things so that we use it as a way to explain what we've experienced, so that we justify a diagnosis.
That's right. It's great for understanding, but be careful what you do with it. Let's be careful with the diagnostic part. Now, the third problem that we're having these days is I call it the problem of spectrums. Autism spectrum disorder. ADHD is mild, moderate, severe. So there's a spectrum of severity with each of these diagnoses. So where is the line between very mild symptoms and getting a diagnosis? And that's harder and harder to find when you have a spectrum disorder. We all like spectrum disorders because you can say, yeah, you have it, but it's really not a problem. Yeah, you have it. Yeah, and it's a serious problem. But it's very difficult to say you have mild symptoms and you have the diagnosis, because there's a huge difference. You can have symptoms, you can have characteristics of a disorder, not have the disorder.
Right.
Now, while there's nothing wrong with learning that some of your life struggles were due to a thing that was beyond your control. You have ADHD, you have autism. There's nothing wrong with learning that. But having an explanation while it can provide comfort, now that I know that it's autism, now that I know I have ADHD, that provides enormous comfort. However, and this is where we caution, especially teenagers who are convinced that they have a problem, that they have a diagnosis, but it can also occur with adults. So while it serves this gives you a wonderful explanation and helps you understand how you're doing, there are these cautions that we have to be mindful of.
Absolutely. And the first is that we really have to be careful that we don't allow ourselves to use a diagnosis as an excuse.
Right.
Just because you have a diagnosis of something, just because you have anxiety, just because you have depression, just because you have ADHD or autism spectrum, it doesn't mean that you're incompetent.
Right.
How many we've seen this happen where someone will have, a history of working for, they've worked for 10 or 15 years, and they get a diagnosis, and now all of a sudden they're saying that they can't work.
Right.
Well, you worked for all those years, but now that you maybe meet criteria for mild autism spectrum, or even moderate autism spectrum for that matter, now all of a sudden you can't work. Well,
right.
How does that fit? How does that make sense? Because when you didn't know you had it, you worked, but now that you know you have it, you can't work. And so we can't allow these diagnoses to stop us from functioning in ways that we're otherwise functioning. People with mental health conditions, people with mental illness work all the time.
Right.
So there's
That's right.
nothing that, people with ADHD, there are physicians with ADHD, there are lawyers with ADHD, there are lawyers with autism spectrum, there are physicians with autism spectrum.
Right.
People still work when they have these things, and so we can't use it as an excuse to back off and stop functioning in ways that we would otherwise function.
Right. You don't succumb, you manage. You learn how to manage. Okay.
Right.
Now you have your explanation, not an excuse. Now you know, now you can get some help dealing with that. So you learn how to manage it better. Okay. So
Yeah.
that's number one. Number two, it can't be your identity.
Right.
And this is the trap that teenagers fall into because adolescence is a time where you're developing your identity. But as soon as a teenager latches onto, I have some diagnosis, then they identify, they're no longer a person, they are autistic, or they have this, or they have that. So a diagnosis cannot be your identity. It doesn't define who you are. You're a person, and then you're a person with whatever, okay?
Yeah.
But that becomes, again, it becomes our starting point. I have these characteristics,
Mhm.
so now I have to learn how to manage them.
Right. So many people will say, well, yeah, I can't help it. I have, I have
Right.
ADHD. No, you still, even if you have something, there is still a choice with some things. You still have a choice
Right.
of what you do for a living. You still have a choice of, this is the case oftentimes with medication. Medication makes it a lot easier. Just stick with ADHD. Medication makes it a lot easier to focus and concentrate.
Right.
But you still have to choose to focus and concentrate. You still have to choose to pick up the book and sit down and read.
That's right.
If you say, I have ADHD, I can't sit down and read for very long.
Mhm.
Even if you take medication, you're still going to, if you still say that,
Right.
you're still not doing it. So you're not the diagnosis. You have symptoms. You have these characteristics that cluster together to identify a diagnosis that then can guide you towards some interventions and strategies, but that's not who you are.
Right. Exactly. Right. And the third issue is a diagnosis can't be your ticket for what I call performance enhancing drugs. And performance enhancing drugs comes from the sports world where athletes are not allowed to take certain substances or banned because they will increase your performance and you get an unfair advantage. Stimulants are a good example of that. You're not allowed to take stimulants if you're a professional athlete. Are you after, if you take drugs, it doesn't matter what the drug is, as you said, drugs simply reduce the symptoms.
Right.
You still have a lot of work to do.
Mm-hmm.
And what worries me about some of the people that we see, there are individuals out there who are seeking a diagnosis so that they can take a medication that actually is for them, it's really a performance enhancing drug. They want, I mean, we have parents whose kids are getting B's and C's and they're doing okay in school. But the thinking goes, if they take Adderall or take some stimulant medication, maybe they could become an A student.
Mm-hmm.
Okay, that they would have just enough more attention or more energy or more motivation that the medication would provide just a little bit extra fuel to get them from all B's to all A's. Right. That's not treating ADHD. That's a performance enhancing drug. I think that's what we have to be careful of, is that a diagnosis shouldn't be your ticket for a performance enhancing drug.
Right. Yeah. And we see that a lot again, and I kind of put it almost in the same category where, you're unhappy with things in your life, you're distressed with things in your life. So, but instead of changing those things, working to make change and, what is treatment really for, is to help improve situations in your life. Right. So instead of doing anything to fix those, we're just looking for a diagnosis so we can get medication to numb us to the effect or to alleviate those symptoms. And it's sort of in the same category there. So
yeah, we can treat the symptoms, but that's just the first step. I mean,
Yeah.
that's just the step along the way. You have to learn how to manage them. So the issue here, I think, more than diagnosis, not only diagnosis, because having the accurate diagnosis can be helpful, but then the next step is intervention.
Right.
And are you interested in learning how to manage your life, or are you just chasing a drug that might make you feel better or might make you perform better? And so that's where I think the question becomes a little more important.
Yeah. Yeah. And I think just wrapping this up as we're wrapping up for this podcast, when people eventually get diagnoses as adults, there are sort of these various reactions that a person
Sure.
may have.
Yeah.
Certainly there's a sense of relief. For some people, it rejuvenates hope that things can be better because now they have a accurate diagnosis and they can get good treatment. But then there's the other side, where people become very upset, very distressed that they have something that they didn't know that they had. And, now they're worried that they're going to suffer and struggle for the rest of their life, or, people go through the grief process. And
Right.
it's really difficult for some people when they go through that. And so people are going to react differently depending on what some of those expectations are.
That's right. So part of the challenge with these adult diagnoses, the child disorders being diagnosed in adults, is you're going to have some feelings. You're going to have all these feelings, and you have to have somebody work through this with you. And everybody reacts differently to this new knowledge that they get. And so somebody has to walk you through all these emotions. And the emotions generated are going to be different for different people. And you have to also add that to the therapeutic equation. Somebody has to address these big emotions that you're going to be feeling after a diagnosis is made.
Absolutely. So, all right. Well, I think that's it for today. There's a link in the show notes to the articles that we talked about. But this is a great topic. Again, I'm sure
We'll be coming back to this one, I think. Right.
Absolutely. So, all right. And until next time, stay happy, stay healthy, and forget to be afraid.